In our today's session, we're going to talk about premature rupture of membranes. So, premature rupture of membranes is simply the rupture of the amniotic sac before labor. If it happens before the 7 weeks of gestation, it is referred to as preterm premature rupture of membranes. So, what are some of the causes and risk factors? Rupture of membranes near the end of pregnancy may be caused by a natural weakening of the membranes or from the force of contractions. Before term, preterm premature rupture of membranes may be caused by an infection in the uterus, such as STIs. The other cause may be a previous premature rupture of membrane in the previous pregnancy. The other thing may be vaginal bleeding, cigarette smoking in pregnancy, low socioeconomic status. These women are most likely to receive less proper prenatal care. So what are some of the symptoms that this woman may present with? The woman will present with a painless leaking or gushing of watery fluids. Or the woman may be presenting with constant wetness of the underwear. So what is our management? Management, definitely we are going to admit this woman for close observation. So we'll do our fetal heart rate. We want to check if the fetal heart rate has been affected. Then the other thing is we're also going to do our vaginal examination. We want to determine the cervical dilatation. Is this woman in labor or not? As well as we also want to check for if the membranes are intact or not. Then the other thing is we can also do an ultrasound, which is also going to tell us about the levels of the amniotic fluids. Then we can also give this woman antibiotics because we want to prevent infection. Then the other thing is we can also give this woman fluids, preferably ring-extracted or normal saline. Then we can also give this woman tocolytics if this is preterm premature rupture of membranes, because we want to stop contractions. Then we also want to monitor the fetal heart rate constantly because it might deviate from normal. So we want to constantly monitor the fetal heart rate, which is also going to help us determine the mode of management that we're going to follow. Either are we going to keep this woman, constantly monitor her until term, or rather are we going to induce this woman or go for cesarean section. Then we can also give drugs such as corticosteroids, which is going to help us in the production of surfactants in the fetus. So what are some of the complications of premature rupture of membranes? Complications, this may lead to preterm labor. It may also cause infection of the fetal membranes, which is chorioamnionitis. It might also cause placenta abruption, which is the early detachment of the placenta from the uterus. Then it can also cause compression of the umbilical cord. It can cause postpartum infection. This woman may also be at risk of having a cesarean birth. There may also be a risk of infection in the fetus and also perinatal mortality. So that's the end of our session. Let me know where you're watching me from in my comment section, and if you have any questions, make sure to drop them in the comment section. Thank you very much for watching, and don't forget to subscribe to my YouTube channel for more content.